Good evening and welcome to the COVID-19 update on Channels Television. I'm Millicent Nwaka. First, the highlights. President of the UN Economic and Social Council, ECOSOC, laments impact of COVID-19 on poor countries and the vulnerable. Director General of the National Youth Service Corps gives assurances to parents that the orientation camps are safe as the nation battles second wave of COVID-19. And South Africa looks elsewhere for the coronavirus vaccine, approaches Johnson & Johnson. And just when we thought the numbers were coming down, last night Nigeria recorded over 1,000 cases in 21 states and the Federal Capital Territory. This is coming after 2 consecutive days of less than 700 positive samples. Meanwhile, the latest figure also indicates that 1,120 patients were discharged last night, increasing the total number of recoveries to 115,755. According to the Nigeria Center for Disease Control (NCDC), Tuesday's recoveries include 478 persons discharged in Lagos State who were managed in line with the community recoveries guidelines. The center also confirmed 21 new deaths, with the fatality toll now at 1,694. Lagos, the epicenter of the pandemic, topped the list of states with confirmed COVID-19 cases, with 214 infections, closely followed by Osun State with 120 positive samples, while the FCT is third on the list with 116 samples positive. Now, the president of the United Nations Economic and Social Council, ECOSOC, Ambassador Munir Akram, has highlighted 3 essential areas for recovery on the COVID-19 response across the world. At the special briefing of the SDG Media Compact, which Channels Television is a member of, Ambassador Akram calls for richer countries to walk the talk and that broader action on science, technological innovation, mobilizing finance and investing in sustainable infrastructure will enable developing countries and economies survive.
When communications, physical communication and transportation has been cut.
The President of the United Nations Economic and Social Council, ECOSOC, Ambassador Munir Akram, has been speaking on how poor countries and the vulnerable have been the hardest hit as a result of the coronavirus pandemic, resulting in deepening inequalities. At the special briefing of Sustainable Development Goal Media Compact, which Channels Television is a member of, Ambassador Akram lamented the problem of vaccine distribution and calls for an emergency meeting to tackle fair distribution.
It is obvious is not going to be fairly distributed to all the world. We have called for it to be a global good, but how do we translate that into operational action? And in this shortfall, the facility will be unable to achieve its goal of fair distribution globally of the vaccine. Therefore, it is my intention to call in a special meeting, an emergency meeting in the next few weeks to look at the situation.
The UN ECOSOC president also highlighted key areas and plans to rejuvenating developing economies.
There are, of course, proposals for restructuring the international financial architecture, to build a debt authority for orderly management of the debt of many developing countries. These are, of course, more complex issues which will need to be addressed in various forums, including the IMF and the Paris Club and other G20 and G7.
How optimistic are you with regards to really solving that issue?
During the question and answer session, I asked about vaccine nationalism and governments meeting the SDG targets.
We need to continue to mobilize the global community, to mobilize governments, to mobilize all in order to see how to achieve the objectives. Zero hunger, zero poverty. How do we achieve that? Those are critical goals. And you know, once we begin to prioritize between the 17 SDGs and the various targets, we will get into a very complex political situation. And I think we should avoid that. We should continue with the efforts to achieve the SDGs and do the best we can in the current circumstances.
The UN ECOSOC ambassador believes that sustainable investment in infrastructure, especially for developing countries, will lead to accelerated achievement of the Sustainable Development Goals. As Nigeria prepares to introduce COVID-19 vaccines, the National Orientation Agency, NOA, is asking youths to join hands with the government in raising awareness on the benefits of the vaccines, especially in rural communities. The agency says the narrative that COVID-19 affects only the aged is not correct, as recent statistics shows that youths are also susceptible to infection and death. The Director General of the NOA, Mr. Garba Abari, during a press briefing in Abuja, says youths have a role to play in educating the populace to accept the vaccines.
As we are currently experiencing the second wave of the virus, we must continue to take responsibility for the protection of all by adhering to the safety protocols and guidelines. As we expect the introduction of the COVID-19 vaccine to Nigeria, we urge the youth to join hands with us to educate our various communities on the need to accept the life-saving vaccine against COVID-19. In the light of the foregoing, the National Orientation Agency National Youth Summit is therefore intended to provide a veritable platform of engagement with the youth on key national issues that are of utmost concern to them and come up with recommendations on ways to effectively and efficiently address them. The summit was born out of the urgent unmet need to dialogue with the youth on a sustainable basis and understand the challenges they face from their own perspectives in order to be proactive and contextual as government in dealing with them.
Curtailing the spread of COVID-19 pandemic in Lagos State is now everyone's business. The former president of the Nigerian Lagos Congress, Issa Aremu, is asking the Lagos State government to work towards producing a local vaccine that will help keep the people safe. He also says the organized labor is ready to work with the state government in sensitizing the public on how to stay safe and reduce the growing number of cases. Well, now let's take a look at some of the facts on the COVID-19 vaccines by looking at the myths. Mr. Augustine Ajijelek, a pharmacist and member Association of Hospital Administrative Pharmacists, joins us here in Lagos. Thank you for joining us on the program.
Thank you for having me.
All right, first, we're looking at a lot of people talking about building capacity. One, to dispel the rumors, the myths on the vaccines. And then second, in terms of building capacity, local production of vaccines in some way. But aren't we a little too late for that?
Well, the Chinese say that the best time to plant a tree was 20 years ago. The next best time is right now. So we might be late, but we are not too late. There's still a lot happening in terms of COVID-19, and we cannot be too late to start something. And I believe the local capacity is something we need to work with. We need to begin to develop it at all levels, orthodox healthcare practitioners, members of the private sector, the primary healthcare level, and even the tradomedical healers that we have in Nigeria. They have a lot to offer. The Plateau State government actually set up a COVID-19 research team headed by a well-known professor, Professor Noel Wanang, and they have even concluded some animal studies on certain local herbs that they feel have value in the treatment of COVID-19. So the local capacity is something we need to begin to fund our universities and research institutes to look into. And I believe at the end of the day, we'll definitely find some things there.
So let's look at some of the myths that are coming up. A new one, which is, if COVID-19 isn't foolproof, why do I need to take it? And this is as against the backdrop of the new strains and how the vaccines are not really 100% foolproof, that, you know, they won't clear these strains.
Yes, the whole thing is about chances. If you have something that gives you 90% chances of not getting COVID, it is better than zero. So the challenge is there, but it's not as if these vaccines are not effective in terms of eliciting some immunity against coronavirus. It is only that in certain strains, the potency of these vaccines or the efficacy is a bit reduced. It is not as high up as it is on the other variants that are not, especially the South African variant. So people should not mix these things up. It is still effective against that, but the pharmaceutical companies and the researchers are anxious about the process. As the virus continues to mutate, they are beginning to feel that eventually, if something is not done, then the mutation will overtake these vaccines and eventually we would have a problem. So some of them are even trying to modify the vaccine very quickly. Some have even said they want to work with a span of 6 weeks.
Is it possible that that might happen, that the virus might overtake the vaccine?
Especially for those who are using the messenger RNA technology, it is a template that possibly they can do. The problem would really be in terms of the trials they will have to do after having done the modification. So it's something we would watch and see. When they said they will have a vaccine in 1 year, a lot of people didn't believe them. And today we have a vaccine. So let's watch.
So a number of conspiracy theories around where the COVID-19, the coronavirus, came from in the first place. And we heard from the WHO team that it was not in any way created or released by people or in a lab. But a number of people still doubt that. What's your take?
Well, the conspiracy theories are not going away. But we knew that this, of course, had origins from exotic wildlife that was being consumed by the Chinese. And of course, since these viruses mutate, they could now they mutated and they could now be transmitted from humans to humans. So that's what we should work with. Now, the truth of the matter is this. However this thing came by, it's a reality. And whether it was created by somebody or it's just a naturally occurring process, it is still out there discussing a lot of damage. And we need to be very responsible. Take the vaccines, avoid, do all the things, all the measures we have been told, the non-pharmacological measures of ensuring that we don't get this vaccine, avoid crowded places, mask up, socially distance, and wash your hands regularly. So we need to observe these simple things, make it part of our habits, because beyond even COVID, washing of hands, using soap or alcohol-based sanitizers, rubs, it keeps a lot of other illnesses away, including gastrointestinal illnesses. So we need to just make it part of our habits so that would actually improve our health overall, not only COVID-19.
All right, we appreciate your time. Thank you so much, Mr. Augustine Ajijalek, a pharmacist. Thank you for joining us on the program.
It's my pleasure, always. Thank you very much.
Well, still to come on the program, NYSC DG on new measures to stop the spread of COVID-19 in camps. Please stay with us. Welcome back. The Director General of the National Youth Service Corps, Brigadier General Shuaibu Ibrahim, has been speaking on some of the measures adopted by the service to adhere to the COVID-19 protocols during the just concluded orientation camp. According to him, it includes a close collaboration with the NCDC and other government agencies to ensure that all staff and Youth Corps members get tested before gaining entrance into the camps. Besides adherence to the protocol, he announced that 110 S-Corps members will also be receiving the NYSC National Honours Award for contributing their quota towards national development.
We never recorded any fatality among the corps members, except we lost a staff who died at the Kano State Isolation Center. If not, all the core members were hale and healthy. And you know, being young, their immune system is very, very strong. Within 4 or 5 days, they recover. And we never had anything. So we want to use the opportunity to thank the federal government through the PTF, the NCDC, the national coordinator, and so on and so forth for the support. And a huge source of money the federal government has invested in the return of these core members to camp. And what the magic was is the RTT test kits, because you all know we are very, very strict along with the NCDC. It's only those that are negative that are allowed into camp. Those that are positive were taken away by the NCDC and state health officials for treatment. And this cooperation worked so hard because the NCDC was so strict. And as I said, the orientation is more like an NCDC orientation, because we are so strict. They carried out impromptu visit to all our camps nationwide to ensure that there is strict compliance to the protocols.
Let's turn our attention to Lagos State, the epicenter of the virus. And joining us to look at the response is Dr. Oladapo Ashinobi, a public health physician. Thank you for joining us on the program.
Very much.
All right. Looking at what the DGNYSC said, all the members, youth corps members were hale and hearty. We're also, on the other hand, looking at what the Commissioner of Lagos was saying today, that Lagos State is recording a lot of younger people who are contracting the virus this second wave than in the first. What do you think is responsible for this?
Well, it means first that you should be happy that more young people are testing. Because if you don't get tested, you don't get a result. So it means more young people are testing. And obviously, if you look at our population demographic in Nigeria, about 50% of our population are less than 30 years old. So if more young people are positive, it means more young people are testing. It doesn't mean the disease is affecting them more. But it's just that more are tested, and then that's the result we're getting. And it also means that they are now a vehicle for transmission. You know, young people are mobile, very mobile. So it means that transmission, they will be the driving force behind asymptomatic transmission. So it tells us that young people need to be very careful who they go, where they go, who they mix with, and more importantly, keep very, very strictly to the non-pharmaceutical interventions.
Do you expect that they can do this?
Well, I think young people are responsible. They've been able to show us, I mean, the last 2-3 months, that if they're organized, they can move things. So if they can organize and be more responsible as to what they do, how they do it, then I'm sure they can help us reduce the transmission.
Lagos State as well is still experiencing lesser deaths than in the second wave, and this is also in spite of the exponential increase in cases, the second wave. And perhaps we might also tie that to the fact that it's younger people who are testing, who are contracting it, and are better, recording recoveries than others.
Well, definitely. Younger people are less impacted than older people who usually have pre-existing conditions. However, compared with January, February, March, April, May, we've learned a bit more about how to manage the disease. For example, during the first lockdown, we discovered that corticosteroids help cut the death rate by 50%. And so that means we know what to do. Also, we found some drugs who apparently were not working, so we stopped using them. And so then, I mean, the people who manage COVID at the isolation center, that is the medical team, the frontline health workers, they've seen many more COVIDs now. So the index of suspicion of what to do, when and how, and then the deployment of resources will likely be better. I mean, some of the measures in Lagos include setting up oxygen delivery centers, which are not really isolation centers. So people could just walk in there. If they feel that they couldn't breathe, then they move on. And so there are a lot of, then also they have a home-based care team that ensures that those who don't even need to go to isolation center are followed up. And it means that they may likely not get worse. And so a lot has been put in place. But more needs to be done to ensure that we break the transmission. non-pharmaceutical measures, and then vaccinations.
But looking at testing, Lagos is doing between 2,000 and 3,000. Shouldn't we be doing more?
Well, testing is getting the test done is a multifactorial thing. One, people need to want to come. So there needs to be continuous engagement to convince people to come take the test, because quite a lot of them will be asymptomatic.
But how about the people who have taken the test and they're waiting weeks without getting the results?
Well, I think that will just get better. You'd have to understand that. Let's assume that 70, 50, 100 people take a test in the 57 local government, or even 20. You're talking about 20,000 a day. To process 20,000 is not a...
We don't have that capacity.
No, not that capacity. It's not that easy. So we need to improve the capacity of both the public, because government saw that the public laboratory cannot do it alone. They approved some private labs. And so as many more private people want to join, and as more resources come to government to expand the public testing, the better. However, we might need to look at, is it possible to change our testing strategy nationwide? I mean, see what happened in the NYC camp. They wouldn't have been able to do that if they used the PCR. They had to use the rapid test kit. So that might provide more access, because you do not need too much high-quality training to do that. It's an on-the-table thing, and within 30 minutes, you get your result. And that will be something we might need to look at to ramp up access to testing.
All right.
But that would be a national policy thing from the national EOC or PTF.
We appreciate your time on the program. Dr. Oladapo Ashinobi is also a member, Association of Public Health Physicians Nigeria, Lagos State Chapter, and a Sustainable Development Consultant. Thank you for coming.
Welcome. My pleasure.
And now the World Health Organization has recommended using vaccine developed by the University of Oxford and AstraZeneca, with experts saying it should be used even in countries where variants of the coronavirus that make the vaccine less effective. It says the vaccines are circulating. It also says that it can be used in people aged over 65, and that spacing out the 2 doses, as is happening in the UK, makes the vaccine more effective. Well, here's more on the COVID-19 global update.
The prediction about the virus, not the first of its kind, comes as a team of experts led by the World Health Organization departed the Chinese city of Wuhan after finishing the investigation into the origins of the coronavirus.
There was no evidence of large-scale outbreaks in Wuhan or elsewhere before December. That's what we said yesterday.
Meanwhile, China has administered over 40.5 million doses of COVID-19 vaccines as of Wednesday. The country started targeted vaccination since December to include more priority groups facing higher risk of virus exposure in a bid to prevent any outbreaks in winter and spring. Meanwhile, South Korea says it would grant its first approval for a coronavirus vaccine to AstraZeneca and will allow use in people 65 years or older, despite advisory panels warning of a lack of data on its efficacy for the elderly. Regulators will grant AstraZeneca's vaccine emergency authorization under the condition that the company must submit its full clinical trial results. Japan is beginning its COVID-19 vaccinations from the middle of next week, says the country's Prime Minister Yoshihide Suga. The government plans to vaccinate medical workers first, then the elderly, followed by people with health conditions and those working at elderly care facilities.
Mr. Speaker, I've said repeatedly that what we will do...
Finally, British Prime Minister Boris Johnson has defended his new border policy, saying it was tough, measured and proportional to try to keep COVID-19 and the coronavirus variants from entering the country. Under the new border restrictions, people arriving from countries where coronavirus variants are spreading will have to pay for 10 days of quarantine in hotels.
Continue to take responsibility. If you have symptoms associated with COVID-19, then please visit one of the sample collection sites in your state to get tested. Visit our website. It's channelstv.com for more updates and a better understanding of the pandemic, plus other stories. That's the program. Thank you for watching. I'm Millicent Walker. Stay safe.